From the outset of the pandemic, residents living in hotspot areas like the one I'm in now near Jane and Wilson have been in need of support, and it's local community organizations that have been providing it. Only now, the workers who had been on the front lines are now on the picket lines.
When I say workers, you say rights, workers! Rights! Workers! Rights!
We have been working even harder than before. We provided all the services this pandemic. Our center has vaccination services run by the staff, COVID testing. Who does those work? We are doing that.
Today, they carry signs after months of carrying the workload for a community in need. Workers from the Black Creek Community Health Center in the heart of Northwest Toronto, the area hardest hit by the COVID pandemic, looking for a modest increase in pay.
They don't want to be out here. They want to be in work. They want to be in the clinics. They want to be doing all the good work that they do. So my message to the employer is, listen, we're a heartbeat away. What's 1% to you?
The 1% wage increase would be all that's allowed anyway after the Ford government introduced Bill 124 in 2019, limiting public sector salary increases. Staff from Black Creek say they're not being given that much despite months of bargaining before talks broke down over the weekend.
They have been the true heroes, you know, in all this pandemic, because they've kept giving all the services they give throughout the pandemic. So if there's some real heroes here, it's these folks here walking this picket line, our members.
Pop-up COVID testing centers and vaccination clinics, like the one at C.W. Jeffries Collegiate this week, have been supported by community health organizations like Black Creek. Their work in getting at-risk and in-need residents forced to be in lockdown, other services throughout the pandemic, has also been key in a dangerous time. Mayor John Tory says that while he can't get involved in any collective bargaining disputes, he does recognize the work that's being done on the ground.
The work that has been done by every single frontline worker in these community health care organizations, in the hospitals, our own city staff, and volunteers in the community has been instrumental to the success we've enjoyed with respect to vaccination in particular, but before that with testing and other things.
Crucial partners fighting COVID on the front lines, now looking for a little something in return.
We deserve respect and value. 1% living in the city is nothing, but we have been neglected for race for so many years.
At this point, the union says it has not heard from management or the lawyers representing the Black Creek Community Health Center since talks broke off on the weekend. They say they are willing to return to the table as long as wage increases continue to be a part of the negotiation.